Hi everyone, Satyam Brown and Dr Chandrika Gibson here from Surya Health. We support people through a wide range of issues at Surya Health, but one of the areas that we've both specialized in for decades is cancer. And so we thought it would be great to pick Chandrika's brains with her extensive knowledge to do with nutrition and cancer. She's been a teacher in both undergrad and postgrad on this topic. And it's such a confusing topic because you have many people out there who still, even therapists who still operate off the old myths. So I know that a lot of oncologists even contact Chandrika and ask about the drug interactions with certain supplements or things that people take. So she's a wonderful person to pick her brains over. So today we're going to look at soy and cancer. So maybe to begin, Chandrika, what's the main kind of myth to do with soy and cancer that you come across?
Yeah, it's one of the really persistent myths when it's coming to nutrition and cancer is this idea based on the idea that soy has a naturally occurring estrogenic effect. People in the past were very concerned that this might mean that estrogen receptor positive cancers would grow in the presence of soy. So the conservative answer in the past was always avoid it. However, that's really changed in recent times. The science is pretty compelling. I mean, you know how science is. It can always change. We're always learning more. But when you look at the meta-analyses of, huge numbers of people have been studied now, and it's pretty clear that soy consumption reduces the risk of cancer.
And is that obviously there are some cultures that consume a lot of soy. So is are those types of studies where they're looking at people from Asian cultures or countries that consume a lot of soy?
Yeah, nutrition's an interesting science. You can't put someone in a laboratory for years and feed them only one food. So, the way that most of the high quality nutrition science is done is epidemiological studies where they look at populations and their typical dietary patterns, and then they correlate that with the incidence of different health conditions in that population. So, that's where a lot of the good evidence comes from. But there's also mechanistic findings around soy and cancer.
And then, are we talking just breast cancer, or there are other cancers where soy comes into it?
Yeah, it's not just breast cancer. Interestingly enough, prostate cancer, although more hormonally driven by testosterone, still the science shows that soy intake decreases the risk of prostate cancer. It also is shown to decrease the risk of ovarian cancers and also colorectal cancers, which might be more a function of the fiber, but it could also have something to do with the phytoestrogen content.
And then what's the actual mechanism here? How does it all work from a scientific point of view, of course?
Yeah. So look, I always remind people that, food is not the same as a drug. It's got lots of different components to it. But when it comes to soy, the active ingredients that have been isolated are called the isoflavones. There's a couple of those that have been studied extensively. And the simple idea is that your estrogen receptors, they act like a lock and key. And so when you've got estrogen naturally circulating, which everybody has, males and females have, but females typically have more, particularly during their reproductive years. So in that time, estrogen is slotting into these perfectly shaped receptors and becoming an active hormone, causing tissues to change. Particularly, it promotes growth. The phytoestrogens in plant foods, which is actually not just soy, but soy is a really good source of phytoestrogens. There are phytoestrogens in whole grains, in lots of beans and legumes, and red clover, alfalfa, all kinds of sprouts and grasses also have phytoestrogens. So you can see in that image that the phytoestrogen is not an exact match for a real estrogen, a naturally occurring estrogen in the body, but it's enough of a match that it fills the same receptor. And when it fills that receptor, it pushes out the natural estrogens, or it means there's no place for the natural estrogens to lodge. So the effect is you have less effect of estrogen. And the excess, if you've still got naturally occurring estrogen circulating, gets passed out in your feces because it's bound to fiber. So plant based foods then have a two-pronged mechanism. Well, they have a multi-pronged mechanism, but at least two prongs. One is the phytoestrogens fill those receptors, and the other is the fiber binds the excess estrogen and you move it out of your body.
And so I know that, for example, people use soy supplements for different things. So one of those examples is kind of like a natural hormone replacement therapy. How does that play into it? Like, are the what are the supplements doing, and do they place people at risk, or what happens there?
There's a lot less known about how the supplements are likely to interact with human biology. One of the issues with supplements is you're missing a lot of the synergistic components that a real plant has. So when you strip things back to just their active ingredients and then you take them like they're a drug, they're more likely to have a drug like effect, which is to raise a level or lower a level of something more dramatically. So, from my perspective, I'm not an endocrinologist, so I wouldn't prescribe a hormone affecting supplement. I believe that real food is the best medicine that we can take. That doesn't mean there's never a reason for supplements, there can be. But again, if you look more broadly, if you kind of zoom out on the science, what is becoming increasingly clear is that people who take supplements that they don't strictly need increase their risk of cancer. So, our biochemistry is quite sensitive. It responds to everything in our environment. So, if you take a high dose of one thing in a supplement, you're going to be throwing out the balance of other things. So, there is a risk there with supplements. When it comes to real food, though, it's naturally limited by your appetite, really. You're not going to consume an excessive amount. And that's, you asked about Asian cultures. Typically, that eating style, and Japan's a great example, is that there are small amounts of soy regularly. So it's there as miso in miso soups, it's there as edamame, it's there as tofu or tempeh or a soy based protein. And so that's a really healthy way to get a good level of soy where you're not just getting the isoflavones, you're also getting the plant fiber and all of those other good things that perhaps we haven't even examined yet.
You're talking about supplements and the risks, and yet the average naturopath who um, kind of advertises that they can help with cancer. There are even those who have had cancer themselves that has gone into remission, and then that's part of their advertising that I've cured my cancer and I can cure yours too, which is always an interesting thing. But I'm curious because many of those types of therapists will prescribe a ton of supplements to people. I mean, I have a lot of clients with cancer that talk about the massive amount of pills and supplements that they take given to them by their naturopath. I'm curious your thoughts on that.
Yeah, look, it's a dangerous game to play. And look, I believe in naturopathy, but the essence of naturopathy is that nature does the healing. And if you create the right environment internally in the body and externally, and you think holistically about the mind, the body, the heart, the soul, the lifestyle, the environment, all of that, then you create the optimal conditions for healing. There's nothing wrong with those personal anecdotes, and of course, people use them to promote various things. To tell their story is a really empowering thing, so I don't begrudge anyone doing that. However, when you think about the hierarchy of evidence, anecdote is very, very low. It's a sample size of 1, whereas when I'm suggesting that the soy food intake decreases the risk of breast cancer in the region of 25% risk reduction, that comes from combined studies of more like 11,000 people. So that's not one person saying, "I ate this or I did this and my cancer disappeared or my risk was reduced." That's, science. That's actually looking at larger populations where there's statistical significance to those findings. So I think that, a lot of practitioners of all walks, all disciplines, they do get kind of locked into what worked for them or what works for the people they see in front of them. And that is an interesting way of knowing and developing, practical knowledge. So we consider that, but we also consider then what does the science show? And the art and science of working in health is to be really person centered, to listen to people's values, and also to integrate what's in the scientific evidence so that what you're offering is the best odds, the best chance of that person thriving.
And then, so then when we look at things like organic versus non-organic, does that play into this at all when it comes to soy? Does it make any difference?
I think that's a really interesting question. And you know that I grew up on a farm and I think a lot about where food comes from. And food science itself is really interesting. The way that agriculture operates in most parts of the world these days is large scale monoculture crops, which means that there is a lot of spraying of herbicides and pesticides so that those crops don't get infiltrated by bugs and bacteria and different things. Soy is often grown in that way. So there is the likelihood of pesticide residue. However, here in Australia, we've got very strict requirements of how much of that pesticide residue winds up in the food chain. So I understand the kind of intuitive appeal of organics, and we might think that we'll get less pesticides that way. But actually, they're just different pesticides used in organic farming. So there's nothing really wrong with conventional soy. If you prefer to choose organic, go ahead. But it's not something that we should be so concerned about when the benefit of the whole food is so strong.
I've been a vegetarian since I was a teenager, and I remember talking to a friend who was a vegetarian, and they were talking about soy as one of their main sources of protein. And my memory of that, because I didn't know at the time, was this really bland, kind of white block of b- whatever it was. Um, but these days, I mean, like we eat a lot of it, and in lots of different forms. Can you talk about the kind of different forms of tofu for people that aren't familiar with it? Because I'm sure, like I did, people have some pretty basic understanding about how you can add it into your diet.
Yeah, I think a lot of people have that experience where the first time they try tofu or tempeh, they get this very bland experience and they think, oh, that's no good. I don't want to eat that stuff.
Mm.
But the good thing about these soy proteins is that they absorb flavors really well. So you can marinate your tofu or your tempeh. Tempeh is a fermented soy product. It's even got some added benefits for your microbiome. So you can choose your preference. There's also texture differences. There's firm tofu that we find works really well in stir fries and curries and that sort of thing. But there's also the softer silken tofu that you can use to make a kind of creamy base for almost anything. You can put it in various kinds of sauces for whatever sort of dishes that you're making. Then you've got your soy milks, and there's a whole lot of them on the market as well, and they all have slightly different tastes. So you can try things and figure out what you like. Then there's your tempehs, there's your misos. There's actually dried soybeans as well, but they will need to be soaked, or you could buy them tinned where they're already soaked. The only real issue with tinned soybeans is the salt content, so you might want to rinse the salt off them first. Otherwise, they're a perfectly healthy option. Um, yeah, I think that's about it. Edamame, miso. So miso comes as a paste. That's a soy product. So you can kind of spread these things through your diet. If you are a tea or coffee drinker, you could have a soy milk in exchange for a dairy milk. And that's one of the interesting things too, because dairy gets a bad rap, and maybe we'll talk about that in a different session. But if you're swapping out dairy for soy, it's a good idea to look for the fortified soy products that have added calcium in them so that you meet your calcium requirements that way.
And then what kind of dose, like how much soy is the right amount? And can we have too much? Can you overdose on soy? Can you have too much in your diet?
Probably not when you're eating it because you'll naturally get sick of it. You won't overdose on it. Again, that kind of speaks to this idea of real food versus supplements. You can trust your own body. That's a message that I give a lot. And I think for people who've had a cancer diagnosis, that can be a challenging message because it can feel a bit like your body has betrayed you and the trust is broken. So, again, I work holistically with this sort of refriending of the body and learning to trust your intuition and your senses so you can eat to, your appetite until you're satisfied and you definitely won't overdose. How much is enough? Well, a couple of serves each day will get you into that kind of category where you're reducing your risk. So a couple of serves could be half a cup in your cereal or in your tea and coffee of soy milk, and then a serve of diced tofu in a stir fry or a vegetable based meal as your protein in the evening, that would be enough. Then you'll also get lots of other small amounts of phytoestrogens just by eating fruits and vegetables and grains. So you'll definitely be, in the right kind of ballpark for cancer prevention if you're eating in that kind of pattern.
And before we finish up, is there anything else that you'd like to mention about soy?
I guess the takeaway for today is don't be afraid of soy. It won't feminize men. It won't increase the growth of estrogen receptor positive cancers. It actually has a positive, a synergistic effect in combination with conventional cancer treatments. So there's no kind of contraindications in that sense. So eat it, enjoy it, find a version that you like, and make it part of your regular eating pattern.
That's fantastic. And I'm sure that's very helpful for many people. Thanks so much, everyone. And we will catch up with you next time. Take care.
See ya.